It's the 5 most fascinating people in Swift Current, proudly supported by the Swift Current Mall, the Center at 1 and 4, the City of Swift Current, where life makes sense, the Living Sky Casino, Live It Up, the Prairie Post, Prairie Life, Prairie People, and by Southwest TV News, reporting the stories that matter to you.
Swift Current Mall is a proud partner of this program, which showcases 5 fascinating individuals. These individuals have made Swift Current their home, and they've made major contributions towards the community.
In today's spotlight, Dr. Kami Chikani, an individual who works to ensure the safety of all residents in our community and for the betterment of all humanity around the world. Dr. Kami Chikani is well known to most residents in the Southwest as the Chief Medical Officer for the Cypress Health Region. When it comes to any issue of public health safety, he is never far from the scene. From condemned buildings to boil water advisories to outbreaks of the norovirus, Dr. Chikani is not only the go-to man for the local media, but also to his fellow staff members in the health region. Chikani has been on staff in the Cypress Health region since November of 2001, with his duties initially including the Heartland region of Rosetown and District. During his tenure in Southwest Saskatchewan, he's witnessed the amalgamation of health regions and the construction of the long-awaited new Cypress Regional Hospital in Swift Current. Prior to coming to Saskatchewan, Chikani's educational path into medicine took him from his homeland in Malawi to studies in India, London, and Atlanta, Georgia. The eldest of 3 sons, Kami comes from a well-educated family. His father is a diplomat. His mother is a home economics major. One brother is a professor of aerospace mechanical engineering at NASA, and a second brother is an electronics engineer with Sony Canada. Chikani says it was a natural choice to head into the medical field.
What intrigues me is what makes a person function. It's like there are many other little people in you to make different parts work together. And I've always believed that when a person is ill, it's just not only that one thing. There's a number of things. It's a holistic approach. And not only that individual, but even the loved ones as well. So when dealing with a person, you are not only dealing with them, but you're dealing with that entire environment.
Prior to coming to Swift Current and assuming his role as Chief Medical Health Officer, Dr. Chikani worked in a variety of areas of the world, including stints in Albania, Malawi, and Zambia. Now, with his feet firmly planted on Canadian soil, Chikani says he enjoys the peaceful nature of his surroundings here in Southwest Saskatchewan.
It's awesome, and I always say that was one of the first things that I did say to my late wife, that it's beautiful here. You can sleep, Nashville as well is also not really a place where you sleep with both eyes closed. You don't have to lock your doors, but of course, as I say, time changes. And yes, we're getting to a situation whereby that's not possible, but in general, it is very peaceful here.
With his daily routine often starting well before 8 a.m. and going well into the night, his job is more than that of the local health inspector. His role in the Cypress Health region includes public health and disease prevention, to working closely with the administrative team. A role which Dr. Chikani takes very seriously, often working around the clock if an outbreak occurs in a local health facility.
I, as a healthcare professional, am accountable to my community, to my society, because I have to see beyond the prescription or ordering that test. There are the other factors that play a role. And because that person has come to me, I've got to help them work through it. I don't have to give them the solution, but I've got to help them to be able to identify where they may need that requirement.
In his spare time, Dr. Chikani is an activist working for the betterment of society as a whole and for individuals who live a world away through his association with the Swift Current Rotary Club. By twinning the local club with one in Limbe, he hopes to raise funds for his school in the village, ensure a safe water system, communal gardening, and a crucial bridge project which is one close to his heart.
In this village, it's essentially got a stream that passes through it. And during the rainy season, which is now, it does flood. And upstream, you've got crocodiles and hippos. And there's no bridge across. The school is on one side, so the kids, when it is possible, the kids will run across on the stones. And, well, sometimes you meet a crocodile, sometimes you don't.
Dr. Chikani has also teamed up with a friend from the Peace Corps to form the Malawi Children's Village in an effort to reduce the number of orphan children in the region.
Initially, we started off with 30 orphans. We grew up to right now, we look at over 8,000 to 9,000 orphans. What we have done is that because of the culture that is there, children, when they're orphaned, are taken up by relatives. Now, these are already relatives who already are facing difficulties. So, as Confucius says, try to help them with inputs. So, either with grain or with seeds to get them to be able to grow that extra food, okay, to feed the extra mouths they have.
Meanwhile, back home in southwest Saskatchewan, with a teenage daughter and a spouse employed within the healthcare system in Moose Jaw, Chikani says his future is wide open, with no immediate plans for change or leaving Swift Current.
It's very stimulating. No day is the same. There's always something new that you learn. Maybe that is why I've been here for 7 years. In most of the other places it's been 4 years, 3 years, but I've been here for 7 years. It's something. There is so much to learn, but also for everything that you receive, you have to give something back.
Dr. Kami Chikani, one of the 5 most fascinating people in Swift Current.